Thank you very much for joining this morning our next BATM webinar, which will talk about travel policies in a new world, or travel policies in the post-COVID-19 era, as you wish. We just for the information, so obviously we will be recording this session so that it becomes available for those who are not able to join us this morning on our website. For the Q&A at the end of the two presentations, please feel free to use the chat function in the system. Once we have those questions, we will be more than happy to handle them at the end of the presentations, as I said before. It's my pleasure now this morning to introduce, first of all, Jeroen Hurkmans from Advito, who will give his presentation on the topic. Jeroen, the floor is all yours. Thank you.
Yeah, thank you, Pascal, and thank you for having me here. Welcome to everybody. We've prepared a presentation which I'm going to share with you and talk about a bit about the theory and what we see, what we advise, but what we also see with other clients, what they're doing, and then afterwards, Geert will share some insights of how that works at the corporation. So hope you enjoy it. As Pascal said, don't hesitate to ask any questions. Hopefully we can get an interactive session afterwards. So let's jump into it. We've done a survey among travel managers, and the highest ranked item was duty of care. The way that you are looking after your travelers. And the question is then, how do you get that across to your travelers? Because your travelers, they do want to know what you're doing, what they are supposed to be doing, and what you're expecting from them. And that's where a travel policy comes into play. And we all know, I mean, the old long 25+ pages travel policies that we used to have in the past, they don't do it anymore. They don't work. First of all, of course, because they're too long. Nobody will read that many pages. But also because people don't look for long reading material. They absorb information in a different way. They want to have it more visual, and they want to have it when they need it and where they need it. So it's not necessarily a search for on the intranet site to look for a long document. No, they want to have it what's relevant for them when they need to use it. And especially in this time when things are changing and they want to know, again, what you're doing and what they're supposed to be doing. So let's focus on 5 areas that are impacting today's travel landscape. And those 5 areas are trip planning and viability, the duty of care, health and well-being, and shifting meeting type behaviors, and the balance between stricter command and control. As you can see in the slide, it says, and the rest of 2020. Well, I think it's safe to assume that that will go for some time into 2021 as well. We had some great news yesterday about the vaccine that seems to be promising, but before everything is officially approved everywhere, distributed, everybody had the vaccine, it would take a bit longer. So we'll definitely be into 2021 as well. And that's also why this will take a bit longer for your travel policy to be in place. So what is it that you need to look at when you talk about trip viability and the trip planning? First of all, you want to make sure that you know where your travelers are. And the best way to do so, and we see that if corporates didn't have that in place, they definitely do it now, is a stricter pre-trip approval process to put that in place. So then you know where your travelers are going. But that's not going to do it. You also want to know how are they going to get there, and when they're going to get there, is it safe to be there? So you need to check many things. So are the airlines flying? We all know that schedules are changing rapidly all over the place, less frequency, sometimes they're canceled, etc. No direct connections anymore where they used to be. So how can they get there? And if they get there, are the hotels still open? And not just at the destination, but potentially even at the stopover place. Because if there is something going on at the stopover location and they can't continue the trip, are they able to stay in that stopover location? What is the risk assessment for the country? I mean, we all know the map of Europe and the world. Unfortunately, it's getting more and more orange and red with restrictions that you can't go there. Is that the same for everybody, for all your travelers, or is there a difference if they are from a certain country and want to go to another country? That's something that you need to take into account. The potential quarantine that they need to take, it all has an impact. And you shouldn't be just checking that at the time of the booking. You should check that up until the time that they're going to travel, because things are changing fast or rapidly. And you want to make sure that you always have, not only you, but also your travelers, have the latest and greatest information so that they, again, know what they should be doing, what's expected for them, and what they can be doing. And last, but definitely not least, make sure that you assess which travelers can and cannot travel. For instance, if there are travelers with a chronic disease, they are more, they run more risk to be infected by coronavirus. We do understand that it is not always allowed, due to privacy, etc., to ask the question, but at least give them the opportunities, let them know that you're considering this, that you take this into account, that they can go to their manager or to HR if something is with their health that has an impact potentially on the travelers, so that they at least can come forward with it and that you can take that into account. The second item, duty of care. It's a big topic. It's just bigger than travel only. So you need to make sure that you do meet with your other departments as well, like risk management, security, HR, IT, facilities, because people might travel to other locations, etc., so that you're all working towards the same objectives and are aligned. If you don't have all these departments within your organization, because it's a bit smaller and it's not so specifically set up, make sure that you still consider all the items and assign those relevant tasks to the different departments. But make sure that you are working in an aligned way towards the duty of care. As I already mentioned, some policy changes that could come into play. Additional pre-trip approval, both for offline, online, depending on what you choose for your travelers to book. I know clients that have completely shut down the online booking tools because they want to have everything booked via the agents, but still have a very strong pre-trip approval. There are others that have built in those approval process into their online booking tools. So depending on what you want, how you approach this, but make sure it's really good included into the process, being offline or offline. Consider, if you don't have it yet, a traveler tracking and tracing system. Make sure that all your travelers are registered with your safety partner if you have them. Make sure that they actually have the app downloaded so that they can always use it. I guess most we're all doing it already. Working from home, virtual tool promotion. I mean, I haven't had so many webinars on the different tools and meetings. So try to promote that. Make sure that you only have people traveling when it's needed. But I'll get back to that in a second. Also, assess how if something goes wrong, how you can get people back, and that they know what to do, who to call, etc., but that they know that they're taken care of. And of course, limit the risk of high risk destination travel. So that's from the duty of care perspective. If you look at the health and well-being aspects, there are different considerations that you need to take into account. Are you promoting direct flights versus connections? I mean, a connection does have another exposure. You have an additional stops or an additional time that your travelers spend at an airport, potentially be in contact with others. So is that something that you want to avoid and therefore promote direct versus connections? How do you want people to get to the airport and from the airport? Do they drive by their own vehicle, take public transport, or haul a cab at the street, or maybe you have pre-arranged transportation for them? Same goes for dining at the location. Do you want them to go into town, go into restaurants if they're open at all, or do you want them to stay in the hotel and have dinner there, or even have delivery brought to the hotel? And what about the breakfast? Often hotels have a buffet. Many people are, again, at the same time, same area. Or are you now allowing to have room service and have your travelers eat within the room? All different things, but all elements where you need to consider how much exposure do you want your travelers to have. You also want to make sure that you anticipate a potential forced extension. If something goes wrong and people need to stay a bit longer in that country, make sure that they can do it. For instance, if they need medicine, that they have additional medicine, etc., so that they are able to get through those additional days. Another aspect that you could consider is the health kits. Depending on the countries, but people need to wear gloves or mouth masks, etc. Is that something that you as a company are going to provide, or is it something that you will warn them and that they have to take themselves, to bring themselves on a trip? So again, all kinds of assessments that you need to do, consideration, who's going to be responsible, and how can you limit the exposure that they have to the virus. The procedures, what should travelers be doing? You probably have them already, at least I hope. But are they clearly communicated? Are they clearly known to everybody? And are they updated with the specifics now for the coronavirus? Make sure that people are aware about this as well. And then the last point here on the slide is find about how do your travelers feel about returning to travel? Are they up for it again from a mental health and anxiety perspective? Is it something that they're open to? Because that's going to be crucial as well. You want to make sure that they are that you discuss this with them as well, and that you also show them that you've done all the things that you can do in order for them to have a safe trip. But do have the discussion with them. The fourth item is shifting meeting type behaviors. What is your definition of business essential trips? The one that did you have one? And if you had one, is it still strict enough, or does it need to be stricter now in this situation? Because what we see, clients, corporates are only allowing business essential trips, but you need to make sure that you define clearly what you think a business essential trip is. And that might differ per corporation, but you need to decide that for your own organization. When they're traveling, when there is a business essential trip and your travelers have to go, what's the best way to do that? Should they have 8 small trips during a year, or are you able to combine some trips and have fewer trips, but longer, so that you condense the meetings. Not always possible, but it's definitely a consideration to take and to discuss. And again, that is not a company-wide approach. Well, the approach is company-wide, but the execution will be on a case-by-case basis, because it depends per country and per objectives of the meetings, if it's possible at all. Of course, the meeting, can it be done virtually? Do you have to go, or is there an alternative? Is it a first time meeting? You never met people? Is it an internal meeting? Is it different questions, different interactions that you might need for the meeting? So try to come up with a set of criteria for your travelers, so that they have a clear guidance, like you could say a decision tree that helps them guide if the trip is truly business essential, or that it can be done in a virtual way. Almost all travel has come to a stop now. We do expect, especially when the vaccine comes back, we do expect that, of course, to pick up again. But what we do expect is that the number of single-day trips, the internal travel and last-minute trips, that potentially will remain more or less than the other types of trips, and that's where we see a more lasting shift in meeting type behaviors for that topic. The last area, the fifth element, is finding the right balance between command and control. Does your travel policy, does your travel program needs to give more structure to the travelers in order to have them return to travel, or do you need to, or do you also want to give them some certain levels of freedom? Maybe you want to be more strict in the beginning when they're booking a trip, then they make the choice to go on a trip, etc., etc. But when they're there, you can't control everything. You can give them guidelines, directions, but they have to make some decisions there themselves, of course, about what they're going to do. So make sure that you do give them enough information about what they should be doing, what they can expect it, and how to handle. So make sure that that information is available for them to make that decision. Well, use your tools to do that. I mean, with the online booking tool, you can give them additional information when they make the decision on travel. With mobile apps, you can provide them with easy accessible information, or even push messages on how they can stay safe. And that's where you really give the empowerment to the travelers. And that's also where we come to the policy. Make sure that you simplify your policy. There where needed, create a COVID-19 supplement policy and communicate that clearly, regularly, and through channels where they actually have access to it when they need the information. So what does it mean for your travel policy? Should you revise your travel policy? I mean, there are pros and cons to that. You could include now, maybe the situation is there that that it's easier to include elements into your policy that normally in normal circumstances would not be possible. So you can use the momentum to get those in. Things are changing, so you need to adjust something. So why not do then potentially the whole policy anyway? And there is an expectation from travelers that the travel policy is very much up to date and reflects the situation with COVID and is updated regularly. So there are pros on why you should be updating your policy. Of course, there are also some cons. I mean, it might be, in some cases, it might be double work. If your policy is relatively up to date, rewriting an entire policy might be too much. Maybe it's not just your priority at the moment. So many things are going on. It takes time to do that. Maybe there's not enough focus. Or maybe within the corporate culture at all, overall, it might not be the right time to do that, to introduce a new policy. So what is it that we recommend to our travelers, our corporates? Is to assess when the last time was that your policy was updated. If it was more than 5 years ago, it was outdated anyway. You probably missed, things have changed already, even pre-COVID, so much that a full rewrite is definitely applicable and should be done. But at the same time, we would recommend what we call a pop-up COVID-19 one-pager. And what do we mean by pop-up? It's just like a pop-up store or pop-up restaurant. I mean, they're there for a limited time, and then they disappear again. It's the same with this COVID one-pager. COVID is here. Hopefully it's not to stay. So in order to address the things that are going to be different due to COVID, put that in that one-pager. And when the situation is back to normal, you can take away that one-pager, the COVID-19 additional pop-up policy. When if your policy was reviewed between 2 and 4 years ago, have a review. There are probably things that you need to adjust. Don't rewrite your full policy, but review it, make some updates. And again, use the pop-up one-pager, because still people want to know what they should be doing right now. And then the third category, if your policy is less than a year old, it probably is up to date with most elements. That's great. Leave it, but then just do the pop-up COVID one-pager. Because again, and I'm repeating myself, but I think it's clear, it's important. People want to know what you're doing, what they should be doing, what you're expecting from them, and how they can go back on the road and be safe, as safe as possible. So that's where that pop-up comes into play. Even if your policy is completely up to date, there will be some elements that are different. And having that policy into and the pop-up one-pager is one thing. You want to make sure that your travelers do know what to expect. How are you going to communicate those changes to the travelers? So make sure, and that's where I started in the beginning of the presentation, they want to have the information not on plain text. They want to have it more visual, and they want to have it at the locations where they actually need it, when they are looking for something. So make sure that you have easy to read, simple, digestible information, the one-pagers, and that you put that into your online booking tool. I mean, there's your online booking tool, you can do so much more with it. This is where people are booking the travel, are making decisions. That's why you need to influence them. That's why you need to support them. That's why you want to give them the guidance. So make sure that it's reflected and shows what you want them to do and what they should be knowing. You could also do that, of course, in all the communication with that you do with your travelers. And also, last but definitely not least, use if you have a mobile app, use it for this. Put some information in there, put the essentials in there, and also use the push the messaging capabilities that you have with a client, to a traveler, in order for them to get the message again at the time that they need it, when they are in that specific locations, when they are about to board a plane, or when they arrived at the new destination, what should they be doing with transportation, or when they are in the hotel, etc., etc. So to summarize everything, assess your program, really look what is crucial for your travelers, for your organization now for travel. Make sure that you have everything done, not just you as a travel manager, but within the entire organization, in order to make sure that when they're on the road, that you've done everything, that they know what to do, that they know that you're helping them, and that they can get the information that they need. And hopefully the vaccine will be there, travel will become normal again, and then this pop-up policy could disappear again. But even after it disappears as a pop-up policy for the COVID, these communication channels that you see here are still a very good way of communicating other messages, because then it might not be COVID messages that you want to have, but it might be other messages. Then you have other objectives that you want to have with the travel program, that you could use this type of messaging to steer the behavior of your travelers. And that was how we approach it towards our clients. The discussion that we have about what they should consider, and to make sure that their travelers are going to be as safe as possible going on a trip.
Thank you very much, Jeroen. Very insightful. Now I have the pleasure to introduce Geert, for those who don't know Geert, but I believe that everybody does who joined us this morning. Geert, can you explain to us a little bit more what you have done at UCB concerning the travel policy in this COVID era? Thank you.
I should unmute myself, of course, because it's going to be easier if we want to talk. Thank you for the question. And as I briefly discussed with Jeroen before, I was going like, what do you mean travel policy and change? But actually, as we were going through it, the realization for me comes that a lot of this, I feel it should not be just done during COVID. So a lot of what is being said here, in my opinion, personal, but that's and that's how we've approached it, should be almost like business as usual. So we have a very high standard in our company of caring about people. I think it goes with the turf. Being a pharmaceutical company, we want to care about not only our patients, but we want that also to be reflected in how we care for our employees. So to give you an idea, our main communication around COVID is a total communication. It's not just a communication around travel. There are travel guidelines in there. We ask people to make sure that they're safe, that they only do business essential travel, etc. So what Jeroen is referring to as a pop-up policy, for us, it's more like in the total approach that we have. It also means that we keep people informed on, do we have any internal cases? What are we doing in our offices? How do we organize home working from home for the moment? Right now, wherever it is possible. We are working from home. When the crisis broke, UCB accelerated the rollout of Microsoft Teams so that we could all work easily from home, etc. In the meantime, that's been expanded even so when people need an extra screen at home, when they would need a new laptop, all that has been set up with remote servicing. So we've done a lot around that, and in general on travel. I'm sorry, I'm putting on my glasses so I can read my own notes. My handwriting is awful, I just realized. So we've done a few extra things already before. For instance, we have a global agreement with Anvil, meaning that all our bookings are sent through to Anvil. International SOS is another provider, of course, who does this. And people get on their phone warnings around what they should be doing, etc. So this is, in our case, an automated process, but not just for when it's COVID. This is something that runs all year round. We have, of course, foreseen the provision of health kits to everyone that needed it, masks, disinfectant gel, etc. And yes, but most of all, what we're trying to do now, and that's I think the main point of disagreement between what Jeroen was saying and me, we are seeing a very strong message from our senior management on, like, can we make this more like the new normal? Jeroen in the end said, let's hope with the vaccine and everything goes back to normal. We don't want that, because for us, this is part of sustainability. Caring for people is one part of sustainability, employee well-being, etc. But we also want to make sure that we keep this momentum going, to make sure that as we go further, travel really becomes intentional, so that people will be reminded to think, do I really need to travel? Actually, it's not just during a crisis that we should only do business essential travel. Why would we do non-business essential travel outside of a crisis? We need to really reflect for ourselves on, do I need to travel? This is a one-day trip. Can I not do this with a more virtual meeting? This is going to help my mental stability, because it's going to be less stressful than being on the road all the time. It's going to help the greenhouse gases. We'll have less CO2 being emitted, and we will on top of that, we will be saving money because we travel less. So the whole thing together, we really want to have that as a total approach, and that goes into our policy. We're still working out on how we want to have this as well reflected in the policy, not just around COVID. We want this to be a permanent change. My boss has a favorite expression, that is that never let a good crisis go to waste, and that is the real example that we want to be looking at that. And we're working that out, as Jeroen was explaining, with messages in our online booking tool. We're still working on the messages in the apps, and we're working on this with Advito, by the way. So they're helping us putting all that together, these messages, and it's really, as I said, a more total approach around that. And that means that we do not necessarily need to adapt during a crisis, but that the setup is there. That's our approach. But of course, more than happy to discuss with Jeroen on what his ideas are around that.
I think, Geert, that we're not too far apart. When I say going back to normal, and hopefully, I mean more from the medical situation, etc. We do understand that there is going to be a new normal. We all know that the 2019 travel volumes will not return, if ever, for a longer time. because people, as you're mentioning, are looking at other aspects. People, it's the well-being of your travelers. They now have experienced that there are alternatives, that they don't have to go for every meeting face-to-face. Sustainability is becoming more and more important for companies. Travel does have an impact on the footprint. So we do see all that those considerations. What we're saying is there will be more of a new normal, and before that new normal, there are elements, especially on the health, the well-being, that we that they run a bit more risk than they normally would. I mean, if there would have been not have been Corona, people could have gone on a trip more easily and felt even more comfortable doing it, even for a business essential trip. So, as you mentioned, you still have business essential trips. That definition can differ per company, but for those people taking those essential trips, you need to make sure that they know what to do, and that's what we're saying. So I think we're pretty much
we're pretty aligned. I was thinking the same thing as you were going through. It's pretty aligned. We are a less mandating company, so we do a lot with questions. Like for the business essential, I find it very interesting that you say we define that either by company. We've decided that we would not define it because we feel that it's very hard to even between departments. What is a business essential trip for somebody in our sales force or in our research team differs quite greatly from what I would consider a business essential trip. So we really want to make sure that the responsibility lies with the manager. So you should have the okay. But as I said, we're not very mandating, so we don't have a formal approval process, but we do keep an eye on it and follow that up. But we leave it more up to the individual and their managers to really define, and we go from the principles. Please make sure that you question it. Now, I must be honest, I was surprised since the crisis broke. I have very little questions. I have not been contacted by the so-called road warriors. I think we already had less road warriors than an average company. So I have not had people coming back to me. No, I'm sorry. One did, saying like, oh, I really feel that I need to travel and that I need to be there and that I need to do this. Quite on the contrary, some of the people came to me and said like, actually, normally I would go here, but I don't feel comfortable. And in the general communications that we have been talking about, a very important part from our HR department has been on mental health and on well-being for travelers. And so they've also been very much looking at, if you don't feel comfortable traveling, you should feel comfortable enough to tell that to your manager. Don't let yourself be pushed into feeling obliged to travel, but go back and say like, I don't feel comfortable. And so what I see as a very big trend internally is that people go like, no, unless I really need to travel, I am not going to travel. I try to avoid it. So is that maybe because we're more of a we're a pharmaceutical company, so we have a lot of doctors who probably are looking at those risks on infections maybe a little bit different than other people, are more aware of the risks or something like that. That might be an explanation. But as I said, I was expecting a lot of people will come back to me and say like, oh, when can we travel again? It's been quite silent. Is it because of our communication or not? That is hard to evaluate, of course.
No, but communicate. I think it's in these situations, it is very important that the travelers, or in this case, then the non-travelers, do feel supported. That you have, and that's what I started with, the duty of care. That you, as a company, you as a travel manager, are looking after them, and that their well-being is important to you, so that they feel strong enough to say, "I don't feel comfortable going on a trip now," and I think that communication definitely helps, because that builds that trust, and that you support them.
Indeed. And we done some silent moves as well. So for instance, our policy officially is that on short haul trips, you should travel economy. As we all know, traveling in economy, social distancing, quite tricky. So what we're doing is that in Europe, we automatically ask our agency, CD, to book people in business. Because we go from a principle, our business is down 80% anyway. So from a cost perspective, this is not really not going to kill us. But we feel that at that point, the message to the travelers is, we're not promoting this. We're not promoting that you should travel, because it should only be business essential. But if you have to go on a business essential trip, we want you to be safe. And so we're trying to help you by putting you in a more easily socially distanced cabin. And in the US, we divert every traveler to which is an easy one because we're based in Atlanta mainly, to Delta, who has vouched that they will keep the middle seat open until, well, at least January. I guess they might even do that a little bit longer. But so that is the way that we then make sure that our travelers understand that we are thinking of their health and safety as well. Did we see some questions coming in, Pascal?
Yes, we did receive some questions. So maybe let me start with Jeroen. One of the questions we received, Jeroen, was based on your observations, what percentage of companies are acting as what you presented in your presentation? Do you have an idea based on your client base? Who is reacting to that?
Yes, I mean, it differs. I mean, if you look at the more stricter pre-trip approval process, that's almost everybody who does that. I think the majority is taking bits and pieces. If you're looking at who actually puts that really into a one-pager or a new policy and rewrite the policy, I would say less than half that actually do that. Yeah.
Okay.
The majority does take bits and pieces, but not like a full document rewrite.
Okay, makes sense. Thank you, Jeroen. Geert, I have a question here. How comfortable are UCB employees to travel again? Have you done any surveys? Have you any idea on percentages related to that?
No, I have no official percentages, but in general, every time I ask a question or I do an update on Yammer, for instance, please look out for this or make sure that you follow these rules. I get a lot of people going back like, we're not traveling, are we? So we're not going yet, are we? So I don't, if without having a firm basis or a survey to show you, I would say that at least 50% of my travelers will not travel if they don't have to before there is a vaccine. I think the vaccine or a real cure would change a lot, of course, but for the moment, that is the trigger.
Okay. And then I have a question as well related to meetings. So we've now been talking, obviously, in this session a lot about transient travel. From a meetings management perspective, have you made any policy changes in that area, or how do you see that within UCB?
Well, no official policy changes, but of course, people have been looking very strongly at virtual meetings, and on top of that, those have been getting such great results that what we see is that I think that even when the meetings will return, because those will return, and I think especially the external meetings with our doctors, etc. It's something that's our core business, so that will return. And there we did a survey, for instance, with some HEPs for our immunology summit next year on what do you think, virtual, hybrid, where do you want to go? And we saw that around 50 to 60% of doctors were already, stating the so-called Zoom fatigue. People getting, everything is now virtual, everything is on the screen, and they kind of want to be able to choose. And so definitely virtual meetings will continue in a hybrid format. But the results for us have been incredible. We have changed one meeting in China to a virtual hub meeting where we had some hubs together, and previously we were reaching like 400 HCPs, healthcare professionals. And this time, by going larger, inviting more and people to individual sessions, we had in total 15,000 visits from 4,000 different people. So instead of reaching 400 people, we reached 4,000 people. So of course, they did all the check boxes and said, like, we're continuing this format, we're going to go on. So we didn't really need to change the policy because people just liked it a lot better.
That's great. Well, the following question is a little bit, you could say, linked to that. Somebody submitted ROI of travel is obviously difficult to measure during this crisis. Do you not think that once the crisis is over, travel will go back to normal to meet financial objectives of a company, or do you believe travel will no longer be necessary to meet these objectives? And if so, why? Can Geert, Jeroen?
I can have a go at that. I think the ROI, indeed, you need to have that. I think, will it only be possible to reach that ROI with travel? No, I don't believe that. I think it's going to be possibly external travel is going to come back to relatively normal, but I think all the internal travel is really going to be reviewed quite dramatically. I think people will be stricter, people will be, and now that they, for instance, in our case as well, I mentioned it, we've rolled out Microsoft Teams to everyone, meaning that this is a very powerful tool that makes it quite easily to have like a video conference. And if you already know your colleague as follow-up meetings, etc., that's good. You will still have, for first-time meetings. I'm a very good example. I'm responsible for the Asian teams. Right now, I only know one person left there because there have been some changes in the team, and I've all hired them by Teams and by Zoom, and I haven't really met them. And you see that there is a difference then, the way that you treat people. It's even when I talk to you, Pascal, on the phone here, we know each other. So of course it's a bit different. Otherwise it would be much more formal. We don't know each other. And so it will come back to a certain degree, but I think people will be less focused on that it needs to be travel. I think it's more the meeting part, and we now have a lot of technology that can facilitate that.
Yeah, and if I can add, well, it's not so much adding, it's actually underlining what you're saying here. I don't think it's one or the other. I think it's in the middle. Travel will come back, but as I mentioned, it will take a while, if at all, the old numbers will be reached again. And to Geert's point, and also what I mentioned in the presentation, it is very much focused initially on external meetings, and the internal meetings, the one-day trips, etc. Those are more easy to substitute, to change into other ways of collaborating, and then there could be still a good ROI for that meeting without traveling. Whereas some of them, you do need to get to know the client, get to know your colleagues in some cases as well. I'm not saying that you shouldn't be doing any internal travel. It's probably just not as much as it used to be.
Indeed.
That makes perfect sense to me. We have, on a side note, and it's not necessarily immediately linked to the discussion we have this morning on policy, but we received a question, and I think Geert, you might give some insights on your thoughts. It's related to hotel and airline contract negotiations. Do they need to be renegotiated due to COVID? And if so, what is the key for you to change? Is it volume, conditions, or something else?
Well, if we have any suppliers on the line, they will probably think like of sending me flowers. I'm not at the office, so don't do that. I don't believe in it, and UCB in general don't believe that we should abuse this crisis to squeeze prices to an absolute minimum. We want to have partners for the long run and want to work well together. Of course, at the same time, we also expect those partners not to start raising prices or and to work with us and think about it. Doesn't mean we did an RFP for hotels, for instance. I did an RFP for hotels, and we've agreed with most of them. Like, okay, if you want to keep the same rates as we had, we have not given you the volume, because it goes both ways. Huh? We have not given them any volume this year, so what would I have as a basis to say that I want better pricing for next year just because they have more capacity? So we try to find the right middle there, and that is not always it's not always clear for everyone. A lot of people, even internally, would go then to me and say like, oh, can we do a better price? And go like, well, what if we push them out of business with that? Is that going to help us? Probably not. So that is our approach, that we do not want to do that, but at the same time we keep the normal things going. For meetings and events, for instance, I changed. We had a program called Efficient Locations, where we pre-negotiated terms and conditions and prices with certain hotels. Due to the situation that we now have, for 2021 we are doing just the terms and conditions, and we're going to go out for the pricing, because how would the hotels price that? They don't know how much requests they're gonna have. We don't know how many meetings we're gonna have. So that you have to adapt it a little bit.
Thank you. I have not received any
Pascal,
other questions. Yes,
if we
sure,
have
Jeroen.
a couple of minutes, I can share something on the air and hotel as well. We do see a difference on air and hotel. On the air side, the most prices are discounts off the published fares. So that fluctuates already with the current situation. There is less demand, so prices are going down, and you benefit from that already. So we do see a lot of clients that have extended their contracts, or airlines and clients together that have extended their contracts into 2021 without going out for an RFP. On the hotel side, it's a bit different. A lot of the rates are fixed rates, and the program that you negotiated at the beginning of, or at the end of 2019 for the 2020, those rates might have been good at that time, but they definitely are not good anymore. And since they're fixed, they're still up at that high level. You do get the bar rate, but that's the same as everybody does get. And even though you don't bring the volume that you used to, you still might bring more volume than others, because it's all relative to the old situation. You're still a good customer relatively to that hotel. So we think that there are two things. It might be a good option to, first of all, to renegotiate, but also to focus on dynamic rates, move more towards the airline situation, so to say, that you do have that fluctuation, and you need to be careful on what discount you do get from the change, because their initial offer is often the same for all properties, and that doesn't really reflect some of the properties where you do drive additional volume to compare to others. So your high volume properties get the same discount as your low volume properties, which in our opinion is not completely fair. So that's something that you need to look into. But I totally agree with Geert. They need to be there in the long run as well. You don't want them to get out of business. So that's a balance that you need to find. But definitely there is, in our opinion, room to improve the program, to drive to the better deals for your program, for organization, but still be a good partner to the hotels.
Thank you very much, Jeroen.
If I can
Yes,
just make
Geert.
one extra compliment. Yeah, I think what I've seen with some of the chains, especially the ones where we already work with quite regularly, of course, is what they did is they say, you know, we're renewing your pricing, but if the market price goes below, instead of just having the bar rate, you will get an extra percentage of the bar rate. We will then adapt that. And that's something new that the hotels have been launching, which I think then combines the best of both worlds, because so you would have your normal rate if that is still a good rate. If the bar goes down, then they still give you an extra percentage of the bar. Then everybody wins, because they know that you will be a loyal customer because you appreciate that. Absolutely.
Thank you very much, Jeroen and Geert. It's been a great discussion, and I'm sure that we could continue for another hour, but we have come to the end of our time slot. Want to thank you again for your participation and your support this morning. Want to thank everybody on the call for joining us. Just as a reminder, our next event, our next webinar is scheduled for the 19th of November, and more information will be distributed later this week. So we hope to see you all on that next exciting discussion that we will have on November 19th. In the meantime, stay healthy, have a great day, and talk to you soon. Take care. Thanks. Bye-bye.
Thank you. Bye.
Bye.